Okay, so we're going to start off. Our first segment today we're switching it up a little bit, is going to be nursing in the USA. And I am joined by a couple of my colleagues, Ryan and Brad. They are on our quality nurse improvement team. They work in our offices here in Cincinnati, Ohio. It's very cold here today, by the way. It was -4 Fahrenheit, which for most of you that don't use Fahrenheit in your country is -20 Celsius. So that's how cold it is. My son's school was closed today, so I'm actually working from home. But wish us luck as we bundle up. And if you're coming to a state that's cold, this is your sign to prepare and buy a coat. So without further ado, though, I'm going to go ahead and let Brad and Ryan take over and share some information about tips and tricks interviewing with U.S. Facilities here. And I'll stay on with them. And if you have questions, by the way, make sure you're posting them in the chat. We will try to get to them. If we don't have time, we'll make sure we cover it after, okay? All right, handing the mic off to you.
Thank you, Erica. As Erica said, my name is Brad, and this is Ryan. We are the quality improvement nurses here at Passport USA, and we're going to spend some time talking with you guys today about interview and interview prep.
Yeah, so one of the first really stages to that big jump into your career here in the U.S. is your interview process with any of the facilities you may be interested in joining. And so what we like to do is just connect with you through a interview prep process a lot of the time to help you prepare for that interview process and ensure that you have a good idea and, kind of understanding of what that would look like. But, with that does come some nervousness and some questions that can, maybe, not catch you off guard, but, it's good to be prepared to know how to handle these interviews. And so just a couple of things we wanted to review. So my first question for you, Brad, is, in your experience, what do you recommend is the best way to prepare for your interviews?
Great question, Ryan. When you have an interview lined up, you want to make sure that you're putting yourself in the best light in preparing for an interview. The first thing that you want to do is make sure that you're on time or be early to that interview. You want to make sure that you are dressed professionally and find a quiet spot that's away from distraction where you can have a conversation. These interviews will be on a video interview with your facility that you're interviewing. You also want to make sure that you're testing your technology and that you have a good internet connection. These are some first steps into adjusting to start your interview. Now, Ryan, what would make a good impression right off the start when you start interviewing?
So it's always good to, be personable in the interview. It's definitely nerve-wracking, right? Meeting someone for the first time, but also the interview itself. I don't think I've ever sat through an interview in my lifetime where I haven't been nervous. And so it helps to be personable, right? Connecting with the interviewer, letting them get to know you a little bit as you are completing that interview, right? So they're not only interviewing you and an idea of can you complete the skills that are required for the job, right? The job requirements, the profession, but also as a person joining their team, right? They're evaluating, are you going to mix well with their culture, how their team operates, but also, letting them get to know you as a person is a good way to sort of make those connections there. Sharing your background experiences, right? That helps them, the interviewer understand where you've come from. What has led you to this point? What makes you so interested and eager to, take your practice to the United States and join their team? And then finally, treating that interview as a discussion, not just as an interview where they're asking all the questions, but also, have some dialogue, get to know your interviewer as well. Is this a team that you're going to be comfortable joining? Is this a facility that you're going to feel comfortable starting your new adventure to the U.S., joining them? And so, maybe you've had some experiences in the interview process. I just wanted to say, if you have any feedback or things that you can reflect on from your experience interviewing potentially, feel free to post those in the chat as well. I know Erica mentioned dropping questions and things. But you kind of in regards to how do you best prepare, what are things that have worked for you? Feel free to share with all your colleagues. And so, Brad, another question I had that often comes up is, what are types of questions that our candidates should expect to be asked?
Absolutely. So we can kind of categorize these in three different areas of questions. You have what are called behavioral-based simulation questions, resume clarification questions, and skill-related questions. To kind of highlight on each of those, behavioral-based questions oftentimes involve a scenario where they're asking about a situation and how you would react in that situation. An example of one of these could be, tell me a time that you worked together as a team and how did you function? With a question like that, what they're looking for is your ability to critically think and share your experiences. So, what we often recommend is taking a clinical situation that you've been a part of and applying it to the question that is asked. What that does is show your nursing process and that critical thinking going forward, and it helps them build kind of a little understanding of your experiences. You can oftentimes take behavioral based interview questions and look at that through a search engine. You're going to find thousands of examples of those out there. I often recommend reviewing those prior to an interview as well. Our resume clarification questions, those are based off of your resume. What is your previous experience? How long have you worked there and what did you do? Be able to talk fully about your experiences and what you've done. Be able to get in detail about that. And then lastly, you're going to see skills related questions. A lot of these are based on the type of unit that you'll be interviewing for. They may be general. What are your experiences with electronic medical records? What are your experiences with different kinds of medical technology? Be able to speak through your experiences and what you have experienced and what you have not experienced. That way they can tailor your position and the ability, what they need to onboard, with that opportunity. So Ryan, when answering these type of questions, how is best to elaborate one's answers?
So it's definitely one of those things where details, matter and can certainly help the interviewer picture your past experience, whether it is a skills related question. Like you said before, if they're asking you about specific skills that are required for that position, whether it's intubation or ventilators in the critical care setting, whether it is specific OR equipment or procedures that they complete, or chest tubes or EKG interpretation on a telemetry unit, right? You're going to want to be able to maybe elaborate and provide maybe examples of times when you have encountered those.
We lost. You popped.
But also when you're talking through, those behavior-based questions, right? Having maybe some examples, right? Answering those questions with your own real life, situations that you've encountered helps them to really understand how you're likely going to respond in a similar situation in the future. So really being able to elaborate on real life examples helps to dive in and give them an idea of, again, like you said, the foundation that you would be coming in with and where they can focus that orientation once you arrive and start in that position.
Brad or Ryan, can I just interject really quick?
Yeah.
Could you guys give an example of that? Like, you, in your experience, maybe what you would say, like, I had this experience doing XYZ, maybe, because you both have a lot of experience working in hospitals, right? I don't think we really introduced you with your experience that you have, but I know you guys have examples.
Yeah, for sure. So, if you wanted to maybe dive in, the more complicated questions, like Brad said before, are those behavior-based questions where he talked about being able to, talk about working as a team. The second biggest one that often is asked, and I can think of numerous times where it has occurred, in the healthcare setting, is conflict, right? Conflict arises, right, where people There's always going to be conflict on every different level in different ways, right? Professional or clinical. And that could occur with patients, their family members, or colleagues, doctors, nurses, and any other assistive professionals. So essentially what often would be asked during that interview is, tell me about a time, Brad, when you experienced conflict in the workplace. Is there a specific example that you can think of, and how did you manage that conflict and resolve that situation?
And so what you would expect with an answer, answering this question is, Ryan, I had a conflict with one of my coworkers. We didn't agree on the way we were going to manage care for a patient. So what I did is I pulled that coworker aside and said, hey, this is the reasoning I believe that we should do things the way I think they are. I gave them the opportunity to explain why they chose to do it the way that they thought. Now, if we're able to come to a compromise for the betterment of the patient, that would be great. If not, then I would want to escalate that to maybe, let's say, the charge nurse, and have the charge nurse intervene at that time to help resolve that conflict. At the end of the day, in that situation, what we want best is what is best for the patient at the end. And if we're unable to do that amongst us, we want to escalate that to somebody higher so that they can facilitate a appropriate result.
Yeah. So,
that's a really good example, Brad and Ryan. And I know I put you on the spot a little bit there. And actually, Nina just chatted in here a question, and she said that is very informative. How do you recommend handling behavioral questions when you don't have a specific example to share? Which is a common scenario. You get put on the spot and you're like, I don't know what to say.
Absolutely. So we always have the ability, once you have an interview set up, to spend some time with one of the members of the clinical team and do an interview prep session. We thoroughly enjoy doing those and help, kind of coach and, practice interviewing. Interviewing's hard, right? The other thing that you can do on your own, Nina, is, as I said, just search behavioral-based interview questions in like a Google or Yahoo search engine. You're going to find thousands of examples. A lot of times they'll give you the rationale on what the interviewer is looking for as well, so you can kind of prepare in that sense.
And I would always say never be afraid to lean on a strong hypothetical. So if you can't come up with a real life situation, which, that's the hardest part of interviews, is like thinking on the spot, right? You can prepare all day with the most common interview questions, and there's always going to be that one that comes out of nowhere that you're like, okay, that's the one question I didn't rehearse or prepare for, which interviewers love, right? They love being able to see the genuine, true person they're interviewing, not someone who knows what questions are going to be asked and just has a recited answer ready. And so a hypothetical or a situation that or have seen has happened before, or you could just present a known conflict and walk them through the steps that you would take, right? You might say, I can't think of a specific example of a patient conflict right now. However, I do know that sometimes patients get mad with or upset with the amount of time maybe it takes for you to respond to a call. Like, here's how I would talk through and manage that conflict. And then you can talk them through, like Brad did, the escalation techniques. If the problem isn't being resolved, who do you get involved in that situation? The communication strategies you use, right? Tone of voice.
A lot of what they're looking for in the answer to these type of questions is your thought process. How do you get to a resolution from the situation that they're asking about? So like Ryan said, if you need to use a hypothetical, it's all about the thought process and how you get from point A to point B.
That's really good advice, guys. If all of us could just keep that like right here on our shoulders when we're actually in this scenario, that's excellent advice.
And so we wanted to before we wrap things up here, I did have one last question for Brad. And so one of the things that is always, kind of important, again, making sure not only is a Are you a good candidate for, good for a facility is what they're evaluating, but also making sure that, a facility meets what you're looking for, right? How do you connect your experience to really represent a facility's vision and goals?
Yeah, absolutely. So when it comes to an interview, you need to do your homework prior to hopping on the interview. What I would recommend is finding out as much information about the facility that you're interviewing at. Find out if they have mission statements, values, what they stand for as an organization, and how you can align that with what your purpose in nursing may be. Um, you could even use snippets of their mission statement in your wording, and that will highlight that, hey, this candidate has read our website, kind of knows about us. But definitely look up the facility, look up the surrounding area, know what you're getting yourself into. Don't fly blindly into that. And then lastly, number one recommendation, you never want to leave an interview without asking your own questions. Have a list of prepared questions ready to ask them, whether it be, what does the makeup of the unit look like? What are the ratios? What does the surrounding areas have? All good questions to ask, but you never want to not ask a question. That shows that you're engaged and you're wanting to be there going forward.
That is such excellent advice. I always say to people, like, you should be, you're going for an interview, but you should be prepared to interview who is interviewing you, right? Like, and that's
Absolutely.
exactly what you just said. And Red chatted in here, kind of similar to what you were talking about, Brad. So maybe just dig in a little bit deeper. How can we research about the background of the interview?
The
I would say probably, I think what I could hear him saying is just how can we make sure, we have the right questions to ask? Like, what questions should we ask? And I will say all candidates, if you get scheduled for an interview, you're going to know who you're interviewing with. Your IPA or IDA is going to tell you, it's going to be XYZ facility in the city and state. So they should have that information to go off of. And then what do you recommend, Brad and Ryan?
Yeah, so a lot of the main simple questions I recommend, are you going to be working day shift or night shift? What are the weekend and holiday requirements? What does the makeup of the unit look like? How many patients are you expected to manage as a independent nurse? What kind of resources are available on the unit, whether it be a charge nurse, nurse educator? Those are some pretty standard questions I would recommend.
Yeah, and
is it okay to ask about, like the facility, maybe the community around the facility? Is
Absolutely.
it okay to ever ask questions about, because, most of our nurses have never been to the United States, so they might have questions just about the general area as well. Is that okay to ask?
Absolutely. Because you're talking to the people that live there. At the end of the day, they're going to have the best information when it comes to what the makeup of the surrounding area is. So that those questions would be appropriate as well.
I think that's a great segue sort of into wrapping things up here is, you always have support here with Health Carousel. So if you need information, you're looking to figure out where to go to gain that information. Facility websites are great places to start. They will always have their mission statement, their values right there front and center, things that they are proud of. Maybe they're Joint Commission certified, a magnet facility, maybe they have exemplary fall rates, right? Patient safety is top notch for them, right? So your supervisor, whoever you're assigned to, right, is always there to help provide, any resources in response to, that interview, right? So if you're interviewing with a candidate and you would like some information, you just don't know where to find it, reach out to your team, reach out to your clinical team here, and we'll be more than happy to help kind of provide some background information there as well. But also circling back, the interview prep opportunity is always there as well. So if you just have maybe a few minutes out of your day when you would want to connect with Brad, myself, or another member of our clinical team, we could certainly jump on a call to make sure that you're prepared for that interview, answer any questions you may have going into it, and give you really just that extra boost of confidence before that process.
Help ease the nerves a little bit.
Of course.
You guys are awesome. And I just want to remind everyone on the call, this is one of the reasons why Carousel International was rated, again, second year in a row, the largest healthcare staffing agency international in the United States. And Brad and Ryan make up a part of the team that helped us get there, and they are there to support you guys every step of the way. So this is one of the big things that sets us apart as an international healthcare staffing agency, is having clinical support, someone who has been there, done that, knows the ropes, and they're here to help you. So I'm going to remind you, they already said it once, but if you have an upcoming interview or you're waiting to interview with a client facility, it is definitely worth your time to maybe schedule a call with Brad or Ryan or someone on their team to help you get ready for your interview. It's that important, right? So thank you, Brad and Ryan. We appreciate you being on today, and we'll definitely have you guys back on again. And have a great rest of your day and stay warm.
Appreciate it. Thanks
guys.
everyone.
Bye.